All right, everybody, welcome back for another deep dive. Today we're going to be talking about lung cancer treatment, all the really amazing innovations that are happening right now. And honestly, it's incredibly exciting how much progress has been made.
It is. It's really a hopeful time, I think, for people diagnosed with lung cancer.
Yeah, I think so too. And, I was just reading this excerpt, actually, from another podcast called Innovations in Lung Cancer Treatment, a conversation with a leading researcher.
Oh, wow.
And it blew me away how much has changed, even just in the last couple of years.
Yeah, absolutely. Like it used to be that, the outlook was really bleak for lung cancer, and it was really just, kind of palliative care and not a lot of hope for a cure or even long-term survival.
Yeah, a lot of it was chemo and radiation. Like those were the big thing.
Right, exactly. That was the standard of care for a long time.
Right.
And, those treatments, they're still around and they still have their place, but they come with...
They do.
A lot of side effects, and they're not always effective.
Right.
But now we're seeing these new treatments like targeted therapies and immunotherapies.
Yeah, and those are the ones that I find so fascinating because it's like we're really starting to understand cancer at like a molecular level.
Exactly. We're kind of moving away from this one-size-fits-all approach to cancer treatment, and we're starting to tailor treatments to the individual patient and their specific type of cancer.
Okay, so like targeted therapies, tell me a little bit more about how those work.
Sure. So targeted therapies, they focus on specific genetic mutations in cancer cells.
Oh, wow.
So you're familiar with EGFR mutations, right?
Yeah.
Those are prevalent in your type of lung cancer.
Yeah.
And so there are medications like osimertinib that are designed to specifically block the activity of those mutations.
Oh, wow.
It's like finding the exact key to shut down those rogue cells.
That's incredible. So it's like these little tiny smart bombs, basically.
Exactly. Yeah.
That go in and they just target the cancer cells. And they leave the healthy cells alone.
Precisely.
So fewer side effects.
Right. Fewer side effects and increased effectiveness.
Wow, that's a win-win.
It is a win-win. Yeah.
So not everybody responds to targeted therapies.
No, unfortunately not everyone. But, that's why identifying the specific mutations driving your cancer is so crucial.
Right.
It's all about finding the right tool for the job.
Okay, so that makes total sense. So we talked about targeted therapies. Immunotherapy is a completely different approach altogether.
It is, yeah.
So this is where we're not actually going in and like attacking the cells directly.
We're not directly killing the cancer cells. Instead, we're harnessing the power of the body's own immune system.
Right, like we're basically saying,
exactly.
Hey, immune system, wake up. We got a problem here.
Right.
We need you.
It's like giving your immune system a boost.
Right.
So think of it this way. Your immune system is like this powerful army, right?
Okay.
But sometimes it needs a little bit of help recognizing the enemy.
Right. It can't always tell
exactly
the good guys from the bad guys.
So immunotherapy acts like a spotlight.
Okay.
It highlights those cancer cells and gives your immune system the tools it needs to mount a successful attack.
I love that analogy of the spotlight because it's like, sometimes the cancer cells are really good at hiding.
They are. Yeah, they're very sneaky.
And then the immunotherapy comes in and it's like, boom.
Exactly. It exposes them.
There you are.
And it's been particularly effective with non-small cell lung cancer.
Really? And that's the type that I have.
That's right. Yeah. So
that's really encouraging to hear.
Yeah, it is. It's not a cure-all, but it's definitely a game changer for a lot of people.
Okay, so we've talked about targeted therapy, immunotherapy. One of the things that I was reading about in that podcast excerpt that I mentioned was the importance of early detection.
Oh, absolutely.
Which,
early detection is key.
Like, I feel like...
With any kind of cancer, really, but especially with lung cancer.
Especially with lung cancer.
Yeah, because it often doesn't cause symptoms until it's already advanced.
Right, so it's like, you don't even know it's there.
Exactly.
Until it's kind of...
And by then it might be too late for the most effective treatments.
Too late to really do much about it.
So you've been proactive with regular low-dose CT scans, right?
I have, yeah. I've been getting those every year.
That's great, because that's one of the best tools we have for catching lung cancer early.
Yeah, and that's one of the things they were talking about in that podcast excerpt. And they were saying that it's particularly important for people who are high risk.
Right, people who are at high risk, like long-term smokers.
Right.
So your diligence with those scans is crucial.
Yeah.
They can spot these tiny tumors that might otherwise go unnoticed.
Right.
And, drastically improve your chances of successful treatment.
Yeah, that's huge. So
it is, yeah.
We've got targeted therapy, we've got immunotherapy, we've got early detection. What's next? Like, what's on the horizon?
That's a great question. There are some really groundbreaking developments in the pipeline.
Okay, give me the scoop.
Okay, so one of the most promising areas is the field of liquid biopsies.
Oh, I've heard about this.
Yeah, so imagine being able to detect cancer early through a simple blood test.
Wow.
That's the potential here.
So no more biopsies.
Potentially, yeah. I mean, it depends on the specific situation, but
Right.
yeah, in many cases, it could eliminate the need for invasive biopsies, and it could really revolutionize how we approach cancer screening and diagnosis.
That would be a game changer.
It'll be huge, yeah.
Okay, so liquid biopsies, that's one thing. What else is coming down the pipe?
Well, researchers are also exploring ways to combine different types of immunotherapies
Okay.
and targeted therapy.
So like a combination approach.
Yeah, exactly. Okay. So creating these even more powerful and personalized treatment strategies.
So basically we're saying we're going to take all the best tools.
Right.
We're going to put them together.
Exactly.
And we're going to create this like super treatment.
Yeah, it's like assembling the ultimate cancer-fighting team tailored to your specific needs.
I love that. So, I'm hearing all of this, and I'm thinking, wow, this is really incredible. Like, there's real hope here.
There is real hope. I mean, lung cancer treatment is evolving at an incredible pace.
Yes.
And, offering more options and better outcomes all the time.
Yeah.
So it's definitely not the same bleak outlook that it used to be.
Not at all. So the message here is stay informed.
Absolutely. Stay informed.
Ask questions.
Ask questions.
Advocate for yourself.
Advocate for yourself, yeah, because, knowledge is power.
Exactly. And it's your health.
Yeah, it's your life.
So this has been a really incredible deep dive.
It has, yeah.
I feel like I learned a lot.
Me too.
And I'm really excited about the future of lung cancer treatment.
Yeah, the future's bright.
And, I think that's the biggest takeaway here is that there is hope.
There is, absolutely.
And that these innovations are happening really rapidly. And it's just incredible to think about what might be possible.
Yeah.
Even just in the next few years.
Absolutely. Who knows what breakthroughs are just around the corner.
Right.
It's an exciting time to be in the field of cancer research, that's for sure.
It is. So keep exploring, everybody. Keep learning. Stay curious.
Stay curious.
We'll see you back here next time.
Sounds great.
For another deep dive.
Yep.